looks absolutely fine. What was your concern?
Oozing out.
Oh, I see.
He's not even trying to walk on his own, and he won't do it for long. He'll drop.
I think it's time to give me a white tablet.
We're not allowed to give out those tablets anymore.
Just as fast.
I checked it when I was changing her, and it is slightly red.
Mummy, don't talk like that.
I'm sorry.
One of my best friends there, he committed suicide, and that's what's bringing me down.
She's having bad nights, doctor. She don't sleep at all.
Right, OK.
Surgery, how can I help?
Come in and take a seat. How can I help today?
What it is, I went on holiday to the south of France.
Okay.
And I got really badly burnt.
Like a sunburn or...?
Yeah, really, my legs were blistered. Really, really painful. I was peeling really bad. I rang the doctors yesterday and they told me to get some stuff from the chemist.
Yes.
Which was this, antihistamine, and... Oh, not that. The nurse also...
Cetraban as well?
Yeah,
okay.
but I put this on and it's burning, it's making me itch even more.
Right.
So I thought I'd better come just get it checked out because the girls at work are like, you never know, just be safe.
And is it stinging now when you apply it?
No, it's just really itchy.
And
but my feet
has
and
it
ankles
improved
swelled up,
since
so.
2 weeks ago, or has it got
the
worse,
itchiness
or?
has got a lot better, but it's mainly my tummy and here, where the blisters were.
Right.
But I was vomiting as well, on like when obviously the first day I
Were
got
you using
burnt.
any sun protection at the time?
I didn't at the time, so that's probably why I got really
Should we have
burnt.
a little look today?
Amelie, hello. Oh, you got your princess crown on. It's not a princess one, is it not? Oh.
It's a pink one.
It's a pink one. How can I help?
I think she might have a urine infection.
Okay, she had urine infections before?
No, but she's been potty trained for quite a long time and she's been wetting herself a lot the last week.
Okay.
And
she's not got sore down there because she's been wetting herself?
No, I checked it, obviously, like when I was changing her, and it is slightly red.
Mummy,
but
don't talk like that.
Oh, sorry. But yeah, she's got. I think.
Oh dear me. Now, are you going to be able to do a little pee for me?
We did try at home.
Yeah. Do you think? Smile. Do you think you can do a little pee in a little pot if Mummy tries to catch it in the toilet for me, and then we can test it?
I don't need a pee yet.
Oh, okay. Well, we'll have a go in a minute then. Is your tummy sore anywhere? Is there any soreness in your tummy?
This bit is sore.
Is it all the way up there? Okay. Do you want to jump up on the couch?
My belly boots are muddy.
I'm going to take those.
That's it. Oh,
That tickles.
have I got cold hands? Okay, that feels all nice and soft. That's good.
Yeah.
All right, do you feel like you can do a pee now? Now I've pressed on your tummy?
No.
Just try and just catch a little bit with that.
I need one.
Oh, she needs one. Good.
Come on then.
I'll be back in a minute.
All right. See you soon.
Up here, sweet.
What time was the appointment? Computers, they don't like Mondays, do they? No problems. Thank you for cancelling. Cheers. Bye-bye. Hello, sir.
So there's no further blisters, but
No,
it is a little
blisters,
bit red
blisters
still,
were
isn't
there,
it?
And just there.
Okay. Fine, okay. I can't see any signs of infection, which is a good sign. It's not pussing, it's not wet and weepy. Now, it will get better. It usually takes a couple of weeks.
It's just that I go on holiday again in just over 3 weeks, so that's why I was a bit panicky.
A sunny place or?
Portugal.
Okay, you have to be really, really, really careful to
Yeah.
avoid direct sunlight, particularly when it's the strongest, and lots
Yeah.
and lots and lots of sun protection. Yeah. I would carry on with just the soothing, cooling after sun type of cream.
Okay.
Antihistamines are quite useful to reduce the itching down, because what we don't want is to scratch and irritate the skin further. So the less touching, the better. Really, it's probably best to just keep them covered up to try and avoid that as much as possible.
Okay.
When you're showering, bathing, just keep to really lukewarm water, because hot water tends to make it more itchy, more irritated, and it sometimes burns a bit as well. But I don't think you need any antibiotics today. And obviously in the future, lots and lots of sun protection, because I think because you've got relatively fair skin, so you're quite vulnerable to sunburn. Okay.
Thank you.
It's all right.
So I'm going to use one of these, look. I'm going to use one of these.
Watch what the lady does.
And it's going to change colour. I'm going to pop it in here, like that. It's going to change colour, look. All right, so that looks okay. So we'll send off the urine to the lab, so that will check for any infection. Just in case she's getting obviously a bit of a rash, so just some pseudocreme just to help with that. All right, so we'll send that off. But if you feel she's getting worse over the next couple of days, then obviously bring her back.
Sure. Thank
All
you
right
very
then,
much.
bye-bye.
Bye.
Just pass. Hi there, come and have a seat. So, problems with the tummy, is that right?
Yes.
So tell me about it.
Well, I woke up and I vomited,
Okay.
and then for a few hours I didn't eat my food, my breakfast.
Yeah.
In the afternoon, my tummy starts hurting.
Okay, where is it hurting? Can you point?
The lower stomach.
You going for a poo? Yeah? And you passing urine, you weeing okay? No problems like that? He's never had an appendix problem before or anything?
No.
No, okay. And you said you're not eating and drinking something or nothing?
I keep on giving you water.
Okay. I just want to check your temperature first, okay? I'm going to put this here. Can I get you to stand up for me? And just open your mouth. Say ah. Okay, and then just lie down. On here. So if I push here, it's okay? Is this hurting here?
No.
So it only hurts if I push here?
Yeah.
So that you can feel?
Yeah.
Oh, yeah. Okay, fine. Then we get you to come sit back up. Okay. What we worry about is if you've got pain here and he's looking dehydrated, he's been vomiting, not eating as much, and he's a little bit tender where I'm pushing, you worry about an appendix. So I think I'm going to refer him to the surgeons.
Yes, hello, it's Dr. Ward here at Farnham Road.
It possibly could be, but it might not be.
It may be that we need to get a sample and send it off and look at it, OK?
What time is the appointment?
Have you looked at the back of your throat or not?
Take it easy, plenty of fluids, a little of the rice.
I can leave it in the pharmacy for you if you like.
It's not a miracle worker. It will take a little bit of time.
That's fine. Concentrate on driving. I'll sort that out for you.
Take care. Bye.
Is that this one? That's a bit quiet, isn't it?
You worry about an appendix. You know what I mean by appendix? Like appendicitis, have you heard of this before?
I'm a theatre nurse.
Oh, you're a theatre nurse. OK, fine. Yeah, so I'm worried about appendicitis, basically. On the one hand, I think it fits. Like you know, we've got the temperature symptoms. Actually, his throat is completely clear, and he's got tenderness where you'd expect it to be. But on the other hand, actually, I had to push quite deeply to elicit that tenderness, and he doesn't have any rebound or guarding. So I'm sort of 50-50, but he looks a little bit dry to me. He's still got a temperature
he's
now.
not drinking as much.
Exactly. And but also, is that because of the appendicitis directly? He's still got a bit of a temperature right now. He's 37.6. So I think I'm going to refer him to the surgeons. Okay, so let me just talk to them now, yeah? Are you okay to go to the hospital from here?
Yeah. What is good for him?
Well, hi there. My name's Mr. I'm one of the GPs for Farnham Road Surgery. Can I refer a patient to you, please? So, 8-year-old boy who's had a 12-hour history of abdominal pain. He vomited once this morning. He's had a temperature on and off during the day. He's off his food. But I still think the appendix is more likely than anything else. Thank you. Cheers. Bye. So, we got there in the end.
Okay.
So he's expected by the surgeons, give them the letter, and then they will call the surgeons to come and have a look at him.
Okay. Thank you very much for your
No
help.
problem. Take care.
Thank you.
Thank you.
Bye-bye.
Bye.
See ya.
Mrs. Chiapetta? How are you?
I'm fine, thank you, Doctor. No, really bad.
Nice to see you.
Nice
How are you
to see
doing?
you.
How are we doing, Doctor?
Just take a seat.
Doctor, that's for you.
Oh, thank you very much.
Only little, Doctor.
That's very kind of you. Thank you very much. Thank you for thinking
Thank
of
you
me.
for yours as well, Doctor.
How can I help?
Right, Doctor. I got real pain in my chest, tired.
Are you able to sleep?
That one, no, very.
Really?
Last night I never sleep, Doctor.
Because
told.
of the pain?
No, for the pain. I don't know why it was. I don't know.
She's having bad nights, Doctor. She don't sleep at all.
Right, okay.
She stays on her bed for hours and hours and she doesn't fall asleep until probably 5, 6 in the morning.
How long's that been going on for?
For a long
Must be going
time.
on for a while now.
Long time, Doctor.
Well, I want to give you an article about sleep. It's a set of natural techniques to change your brain biochemistry, to increasing the amount of sleep chemicals your brain produces.
Okay.
So it's by changing your environment, you change your brain and you make it more ready to sleep. And everybody will have to kind of take part in them.
Okay.
It'll probably send you all off to sleep after a week. It will improve your sleep, and it's the best article for patients that I've ever seen on lack of sleep or insomnia.
And it works?
Oh, it really works, yeah.
Okay, we'll try it.
Yeah.
We'll try it, definitely.
Yeah. It's just a natural way of tackling this. For a good night's sleep, I would recommend the following techniques. Avoiding alcohol, nicotine, and caffeine because these are stimulants for the brain.
I'm feeling really tired, extremely tired. All I want to do really is sleep.
Increasing warmth because that turns on your brain's sleep chemicals. So that would be a warm bath, a warm drink.
You're very tired, aren't you?
Your environment, reducing bright lighting, reducing very noisy music, no noisy TV, because they again stimulate the brain.
I do sleep very well.
Okay.
I usually fall asleep within the first 20 minutes.
Okay.
Then I wake up after 3 or 4 hours and that's it.
Relaxation techniques, get yourself into a relaxed state because that helps sleep.
I'm so tired.
How can you be tired when you're going away on Thursday?
Well, I think that's why I'm bloody tired.
Avoiding strenuous exercise or eating large meals in the 3 or 4 hours before bed.
I don't sleep well since we had children.
Is it that bad?
Sorry.
The commonest reason for insomnia, by far, is people's anxiety about their sleep. Most of us wake for 1 to 2 minutes every 2 to 3 hours. That's not unusual. Don't worry about it.
I need to ask you something about she's got really bad breath, really bad. Is there anything that she can do for it?
Yes, she needs to increase her intake of fluid to 2.5 litres.
Of water?
Water or anything. No.
All right,
Lovely. Nice to see you.
Thank you very
Yes,
much.
and I hope
And thank you to see me,
once you're very welcome. Once you understand this, I want you to be practicing it every night. Okay?
Yeah, we'll do, definitely.
Yeah. But of course, they might do it themselves, and you'll all be sleeping. Yeah.
Thank you so much.
Yeah. Bye.
Bye.
One moment. Women's health, that's to get the pill and stuff, isn't it? Okay.
But we don't have any clinics.
None.
Is it for the pill?
Yeah.
Find out when they run out.
They run out, yeah?
Yeah.
I'll do that.
God, it's so hard being a girl.
Can you imagine? I literally...
Taking a pill is horrible.
I couldn't... Good afternoon.
So my name's Dr. Siddiqui. Sorry for running slightly late. This
No
evening.
worries, boss.
How can I help?
I think I've got some carpal coming on in this hand.
Right, okay.
Because I had it in the left hand about 8 years ago.
Okay, fine.
And I think it's coming on this one because I'm getting pins and needles. Sometimes when I go to pick stuff up, it's like an electric shock.
Okay.
Runs up the hands.
Fine.
And, yeah, and they're sort of like, from time to time, they feel numb.
Okay, you've had it in that hand before?
Yeah, I had it in this one. And they've done the op.
Okay.
And at the same time, they did a steroid injection.
Into this hand?
Into this hand.
Okay, fine.
But, so the feeling, the sensation's back again.
Okay, how long's it been back for this time round?
About 3 weeks. Pins and needles from time to time, just, you know, it's just aggravating, that's all it is.
Carpal tunnel syndrome is a condition caused by pressure on one of the nerves as it passes through the wrist. It can cause numbness and tingling. It can also cause pain, which feels like electric shock sensations in the fingers. And in extreme cases, it can cause wasting away of the muscles of the hand. Would you mind taking off your coat? I can have a quick look at the rest of your... Right. So, can you feel my finger here?
Yeah.
Here?
Yeah.
Yeah. Here? Yeah. And that all feels normal?
I mean, I could feel that, no problems.
Yeah.
It's slightly different, but not a lot different.
Okay, different to this
Yeah.
here. Okay,
Yeah.
fine. Now, I'm going to just tap on here. Does that bring on any sensation at all? Electric shock type sensation? Nothing like that?
No.
No, okay. Now, can you try and do this for me, where you put your hands together like this?
All right.
Yeah. And just bring them up so the arms are straight. Is that causing any of the same type of pain to come on at all?
I've now got pins and needles in that finger there.
Okay, fine. So, right, just a few movements quickly. Can you squeeze my fingers as tight as you can? Good, that's fine. Can you put your fingers together like this? So, thumb onto the little finger, and just don't let me open them. Good. And thumb onto this finger. Good, fantastic. That's all fine. So, the power is normal. I mean, I don't think it's that bad that it needs any steroids at the moment.
Right.
But certainly you could benefit from a splint to try and keep it steady and try and prevent the pain from getting worse. If that doesn't work, then you may need a steroid injection.
Right.
A steroid injection is given directly into the wrist, and it works to relieve swelling and reduce pressure on the nerve. It's a very good treatment option in the short term. Surgery is generally used as a last resort when the symptoms are persistent or when the other treatment options have failed. A ligament in the wrist is cut, which allows more space for the nerve and reduces the pressure, and thereby reduces the symptoms that the patient's experiencing. You can try ibuprofen as well to see if that helps, because it's an anti-inflammatory. It may help with the type of symptoms that you're getting.
Right.
Is that all right?
Yeah, that's fine.
If that is not controlling your symptoms, come back and see us.
Yeah.
Is that all right?
Yeah, that's fabulous, yeah.
Hopefully that helps with your symptoms.
Nice one,
All
Doc.
right?
Cheers, mate.
No worries.
Nice one.
Take care.
See you later.
Bye-bye.
All right, how can I help you today?
Went to see Dr. Taylor.
Yes.
Because I was getting lots of bruises on my leg, which I keep getting.
Okay.
And I don't bang myself.
Yeah, they just happen.
They just happen.
Yeah.
It's a sort of bruising that I get.
Have you got any at the moment?
Not at the moment. That one is starting to go down.
to
That was
fade.
sort of down there.
And how long have you noticed this happening for?
A couple of years or so.
So I wonder whether this is happening in the area that it's happening because of your veins. So it's something called venous insufficiency. In some people, as you get older, your veins aren't as good at getting the blood back up. So what normally happens is, if you've got the veins where it sends the blood back up, right?
Yeah.
This relies on the muscle action to act as a pump. So whenever you're walking and things, you'll pump the blood back up.
Yeah.
But the thing that stops it from just dropping back down due to the effect of gravity is you get these little valves.
Yeah.
And they're like one-way valves. So they'll let blood go through this way, but not come back the other way. So as you pump, it just goes up and up and up. And as you get older, these can get a bit incompetent. So as a result, you end up with a bit more backfill, which can cause skin changes. I don't know whether the bruising is linked to that, but it's the only thing that I can think of that would be a reason.
Yeah, because I do tend to get cramp in my calves as well.
When do you get that?
Night time.
Have you had restless leg syndrome?
I've heard of it.
Yeah, so that sounds...
I don't really suffer from it, though.
This sounds like it might be
Yeah.
a version of that.
Yeah.
What I want you to do is try taking magnesium supplements. That can help with the cough symptoms. So that's one thing. But from the bruising, I think the only thing I can do is try and reassure you that I'm not worried there's something sinister going on.
Yeah.
If you start getting any swelling symptoms of the ankles, if that starts causing you problems, then come back to us, because there are other things like stockings.
So the stocking be sort of like you get for thrombosis, that sort of thing.
It's a similar sort of idea, but this time it's to try and stop the fluid effect of it. But you're nowhere near that at the moment.
Fingers crossed I don't get any.
Oh, you will be teased. Tell the grandsons that you're wearing stockings.
Oh, look, Grandad's wearing stockings.
So I'm not going to give him ammunition for that today. Take care, okay? Nice to see you. Take care then. Bye-bye. See you. Nice to meet you. Bye-bye. Bye-bye.
How many tattoos you got?
16.
Have ya?
Only little ones. Most.
She's had like a heart of forget-me-nots with Dad on it. I'm not going to have all that.
How much does it cost?
Depends what you want.
But do it on the inside. Oh, look at me.
Do you know how much I charge for these?
I should have asked first before you did it, shouldn't I?
They're really clammy.
That's because I'm...
Hot stuff. That and that was 40 together. That was, I can't remember, I was really drunk.
Lawrence Perslow, please. Good afternoon. Have a seat. Okay, how are you?
Yeah, not too bad.
How can I help?
A bit of a problem. I've had it for nearly 2 to 3 weeks. I've got a cyst on the back of my ear. It's got really sore and it's really irritating my sleep.
Has anything come out of it?
Nothing.
No. Okay. Is it possible if I just have a look?
Yeah, sure, I will.
There is a change on the skin here.
Yeah.
Is that hurting you?
Yeah, just a little bit, yeah.
Right. But it's also tender here?
Not really, no.
No? OK. So it's possibly when it rubs against the back there.
Yeah, that's it, yeah.
All right. Can I check the glands in your neck?
Yeah, sure.
Any other symptoms with this?
No, that's it.
I mean, looking at it, there does look like there's something that wants to come out a bit.
Yeah, it feels like it's like floating on top of the cartilage.
It looks like a bit like an acne spot. You know, if you squeeze them and you get yellow pus coming out. So very much like that. Now, if you've had it for almost 2 weeks and it's becoming bigger and bigger, because of where it is on your body, it can get more tense and painful because the skin is so thin in that area. So if you want, then I could give you an antibiotic.
I was just wondering if I can get cut out or something.
That might be more extreme in terms of management at this stage. But if you want help for pain relief, ibuprofen might help with the swelling a bit more. And then on top of that, I'll give you an antibiotic to help calm this down. Yeah? Is that all right?
Yeah, that's fine.
OK. Is everything else OK at the moment?
I ain't gonna lie, I've got some mental health issues as well.
Yeah.
I can help.
Hello, my darling. Repeat prescriptions.
Come here for a very, very small purpose.
I'm trying to get a repeat prescription.
My prescription is ready.
I left my prescription medicines in one of my relatives' house in Northampton.
I lost my prescription. Am I able to get another one? Or have I got to see a doctor?
I need a list of my prescriptions for the hospital. I don't even know who my prescribing doctor is. I haven't got a clue.
Prescription full, Mr. Bonavisky.
Been asked to give you these, Jim.
See,
Don't shout at me.
when's the last time I shouted at you?
Francesca Barnes, please.
Oh, no, don't worry about that. They change me around all the time, so I'm never in one place twice.
Okay.
Take a seat.
I forgive you for that.
What can I do for you today?
I take tramadol 2 or 4 times a day. That is the hospital order. I got a
Phone call from Kay the chemist last night. Mrs. Barnes, I'm sorry, but you can't have any more of those tablets. The doctor stopped it.
Do you know they haven't stopped it because your prescription has been done yesterday. It wasn't. The problem is it can't be done electronically because it's what we call a controlled drug. So we can't send it electronically across there. Let me go and see if it's sitting outside for them to pick up.
Yeah, it should be there. But she told me no. All the others they got it, but not the tramadol.
But the pharmacy won't get it electronically, so all the rest goes zapping through the air. But the tramadol has to be printed out because
so
it's
it might be standing up on the tree somewhere.
Yours hopefully will be on a piece of paper. So I'll go and have a look. Can we look up wherever the scripts are now, Francesca Barnes, because she's only come in to get her tramadol script, which seems to have been done yesterday. Oh, thank you so much. There it is. We're sitting outside waiting for them to pick it up.
I'm going to have a go with them because I didn't sleep.
They must know that we cannot send this electronically.
Well, they've done it all the time.
I know. I don't understand. But it was done, and it was done yesterday with all of your other tablets.
Don't worry about it, but must have tramadol because last night I didn't take it.
Oh, dear.
And I could have cried. I think it's time to give me a white tablet.
But the one to... We're not allowed to give out those tablets anymore.
Just as well. Because...
We have to refer you to the vets.
Now you fill up with me, so I better go. Well, you got
fantastic.
a lot of work.
There's a lot of work today.
And
you're
if
right.
somebody listens when we get told, we talk.
That's for you. And look, I've dropped this one.
Okay, I'm sorry.
Oh, we're only treading on it as well.
Oh, well, never mind.
There we go.
Thank you.
Nice to see you.
Thank you very much.
You take care. Bye-bye.
Bye.
I do have, I ain't gonna lie, I've got some mental health issues as well.
Yeah.
Because I've got a doctor's note to say I can't work with my anxiety and with my depression. I've got this, I've got ADHD and dyslexic. I've been diagnosed with dyspraxia as well.
You were on tablets before to help with your symptoms, is that right?
No.
No?
They did ask me if I want to go on them, but I've refused.
Okay.
Because I had one of my best friends there over 10 years ago. He committed suicide. And that's what's part of it was bringing me down. Because with my nan and granddad dying and that a few years ago, I've got a lot of anger and that inside me. At all the funerals I've been to, I've never cried once.
So your friend passing away was a bigger moment in your life?
Yeah, and my nan and granddad.
And your granddad, okay. How old was your friend?
He was about 26 when he passed.
And was he on treatment? Is that?
Yeah, he was on medication. That's what made him a bit worse.
Right. Obviously, there might be more to it, but this is exactly what we need to talk about in more detail to explore why, or how that might be affecting you. But obviously, you've got your own individual things that you need to talk about and deal with, perhaps. So definitely come back. Even if you feel you need a double appointment, at least we can go into that in more depth. Yeah?
Yeah, definitely.
This is for your ear for the time being.
Okay.
It's fairly simple antibiotic, but if it does get bigger and starts to spread to the rest of the ear, come back. And then for pain, shall I write it down for you? Do you have ibuprofen at home?
I have no paracetamol or nothing.
No? Is it something you can buy?
To be honest, I'm not the richest person. I am broke.
Okay. Last time the doctor went quite a lot in detail about your thoughts about harming yourself and things like that. Has that ever crossed your mind since you last saw the doctor?
I have, yeah.
Okay.
Because I've got some family problems. I've got my own problems, and that's just bringing me down. I'm just getting really depressed and that.
Right.
I don't think I'm going to harm myself, but I do want to hurt myself.
Right. Okay. Can you go to week's drive surgery?
Yeah, I could do that.
So I think it's important we do look at this. Okay, so that's a Wednesday. All right?
Okay.
So that will help hopefully solve your ear problem for now. All right?
Okay, then.
Is that okay?
Yeah, that's fine. Thank you very much.
All right, take care.
Cheers.
Bye-bye.
My knee felt really dodgy. I was playing football.
Yeah.
Like I think I'd bent it one way, it was fine, but then the next morning I couldn't walk on it at all.
Okay, yeah.
It's been, well, God knows how long now, and it's still like killing. I can't run on it or anything.
Okay, so not playing sports on it at all?
No, can't do anything on it. And I'm a PE teacher, so it's quite hard at the minute to not do anything.
Yeah.
I can do all this stuff, but it hurts when I get to there. I can't balance on it or bend down on it.
And what happened? What was it, a specific thing, or just after playing football you noticed?
It was basically someone had come in and buzzed me, and I think I'd put weight on it and tweaked it a little bit.
Yeah, okay.
And then I managed to play on, but it was hurting like mad. But the next morning, like, couldn't walk on it at all.
And in the meantime, has it been sort of swelling and going down or anything like that?
I haven't noticed any swelling, but it just hurts.
Okay, fine. So let's have a look at your knee first.
Yeah.
How should we do this? Because with the jeans, will they come up?
No.
I'll tell you what we'll do. Can I get you... If you just take your jeans off for me and then come around there, and then just have a seat up on there, and then I'll have a look at it that way. Just give me a shout when you're ready, yeah?
Yeah.
Your left knee, wasn't it?
Yes, yeah.
Good to go?
Yeah.
All right, so let's have a look at the two together. Just bring that up.
Yeah, that's where the pain is inside there.
The joint itself is pretty stable, actually.
Right.
And doesn't look particularly inflamed either. All right, let you get changed and we'll talk through it.
Cool.
Okay, so basically, on the one hand, it's 2 months worth of pain that isn't really settling, and that's with you not really doing any sports on it. So that, on the one hand, that's a little bit worrying that there might be something more significant going on from that injury.
Yeah.
But on the other hand, when I examine your knee, it's really stable, you know?
Right.
So testing the ligaments, it feels pretty stable and feels kind of normal.
Okay.
So the issue here is there something that would need surgery? That's when you start to get to this time frame, 6 weeks and above, you start thinking, well, is there something that's going to need surgery? And the thing that goes against that is how reassuring the examination is. I think at the moment what I'm saying is what I want to do is give you some anti-inflammatories if I can, or something to help with the pain to try and normalise what's going on in terms of the function, right?
Okay.
The second thing is whether we do physiotherapy. So I think if it's been this far down the line, physiotherapy would be useful.
Yeah.
I think if all of that doesn't work, then the next step is going to be referring you on to a knee surgeon for them to consider imaging, basically, to see if there's anything that needs to be doing.
Okay.
Fantastic.
Thank you
All
very
right.
much.
I hope it gets better.
Yes.
Take care, okay? See you then. Bye.
Ryan was the only one that noticed my hair.
What have you done to that?
Had it coloured.
What with the greys, ready for Christmas?
Yeah. I did them with blonde, so they still look grey.
Come and take a seat on Mum's lap, hey? That might be better. What's the problem?
I had a chicken pox.
Yep.
Probably infected her.
Yep.
So I found some spots.
Let's have a look, shall we?
Bubbly one.
When did you have it? That's terrible having it as an adult.
Oh,
How were you?
Tell me, I'm better.
Yeah.
But it's still, you know, it's drying out so slowly. And my ego, you know.
You didn't have it as a child?
No.
No?
No. I could avoid it for 40 years.
How is she in herself?
She's fine. She doesn't have fever. I didn't have.
Yeah, it is. There's one there.
Yeah, and on the back.
There's one there. There's
Yeah,
one there. That little blistery thing on the top there. Yeah. When do they start today? Or?
I found 2 spots yesterday.
Yeah. So yes, I think it's chickenpox. So the same thing that you probably heard about for yourself. Okay. So it's it's a virus in any case. So you can feel unwell with it. Adults normally more so than kids. And in fact, with adults, you can get some really nasty, sort of terrible headaches that come with it, and often a chest complaint as well. Whereas kids often don't have that, so they tend to have a milder form. Some of them will get a few spots, and that's it. And others will be covered in spots.
Yes.
Okay. You can try whatever you want to stop the itch. It'll be itchy. They'll probably scratch them. Okay.
Yeah.
You can use a bit of calamine lotion or something just to dab on it. It's not a miracle. Okay. So it will still probably cause some problems. The times that we worry about it is if some of them become infected on top of it. Okay. So if you've got a scabby thing which becomes really pussy and really red and the red's spreading, then we would need to see her because that's probably another bug that's just got on top of that. Or if she starts developing on the edges of her eyelids, we will sometimes use an eye ointment just to protect the eyes from that, okay? But if she gets any temperatures and fevers, then just a bit of Calpol. Make sure she keeps up her fluids. See how you do.
I know. All right. Thank you very much.
Okay. Good luck.
Yep. Fingers crossed. Thank you so much. Okay.
That's fine. Thank you. Come in.
Are you able to change a quantity of patches for me?
I'm able to, but whether I will do it or not is another thing. Just take a seat. So what's your name?
Kearney.
Oh, you're Kearney, are you? Yeah. Yes, it's a very unusual name.
No, I know.
Yeah. Sounds like a name that you'd come up with in Neighbours or something like that. You're not Australian, are you?
No.
Okay. So where'd you get the name?
My mum said it was from a man's surname.
Oh, right, okay.
Kearney.
Oh, right, imagine. Very good. So that's where it came from, yes.
Thank you.
There you go.
Come on.
Sorry.
Sorry to keep you waiting. It's been.
We've got 2 live wires at the moment.
Have you?
Yeah. Right, sit down then, please, baby. Oh.
No, what can we do for Maliki?
He's almost 18 months now.
Yeah.
And he's still not walking.
Right.
And when he tries to walk, it seems to be this leg kind of goes in, his whole foot turns in.
Yeah.
So I don't know if that's stopping him or anything. But I had issues with my feet when I was a baby, and so did his dad.
Yeah. Can we just take these off and see what his
Yep,
feet
that's
are like?
absolutely fine.
And also let's see him standing. Generally speaking, children walk between 9 and 20 months. If a child's not walking by 18 months, it's advisable for parents to bring them to see us. It doesn't mean we'll refer them on, but at least we can have a look and see if there's a real problem that needs dealing with.
It's this foot that goes all funny. Come on in.
Keep him going, see if we've got.
But I mean, like, he's not even trying to walk on his own, and he won't do it for long, he'll drop.
Drop. Yep.
Hands like this. Let's go up. Good.
I've got this problem with my head.
I've slept funny from my knee.
I have a problem with my toe.
There's a big chunk of wax.
Sometimes I've got dizziness. Sometimes I've got, like, headlessness, whatever.
I can't even put my neck out, it kills. It just feels like I can't bend my leg. This is blowing up.
I can actually see it through your jeans.
I've got bad toenails. Look up for me.
Oh, yes, indeed.
Say, overriding of the toes.
Keep your head still, look at my finger, and follow it with your eyes only, OK?
I fell out of bed. Don't laugh.
That hurts, doesn't it? Sorry.
Do you take confessions?
Yeah.
I did go off my tablets. I don't drink, I don't smoke, so...
There's your problem.
Oh, I'm going to start all my GB says.
You're right. I mean, he's very flat-footed, so what I'm going to do is refer him to the podiatrist, but that will need some correction. But if he's not, you can't sort of correct it before he starts to walk because it's of no use.
Oh, I know that. I used to have boots when I was younger because I used to walk on the inside of my foot as well.
And he's doing the same. So I think he may need something like that. What I'm going to suggest is if you can keep encouraging him, because some children are slow to walk, and if there's a family history, it tends to run in family. I'm not terribly worried even at 18. Some children up to 2. If it's after 2, then you sort of begin to think of other things. But I think because of the very strong family history, because he's got what we call a biomechanical problem, that's probably not helping him, OK? I mentioned that Maliki had a biomechanical problem, and in his case, it was his feet turning in. It may just need a simple type of boot to help correct the in-toeing. It may need some physiotherapy. If it was really bad, there are some cases that need surgery, but that's very rare. If you come back to see myself or Dr. Ward, because I have a special interest in musculoskeletal things. OK.
Thank you, my dear.
OK.
Can you open the door for me?
Can you get it?
Can you do
Pull
it?
hard. Now, this is a very heavy door. Yeah.
Pull!
Pull.
Yeah, he's got strong muscles.
He obviously has.
He's my superhero, that one.
Good, 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 good. Good. OK.
Thank you.
Take care.
Come this way, baby.
Romek, please. Hello.
Thank you.
Right, you have some stitches to come out.
No, they're out. I had the surgery about 4 weeks ago.
Oh, right,
And
OK.
had the stitches out about a fortnight ago.
We'll have a little look. And what surgery did you have?
Neck of the femur
Oh, right.
broke and I snapped. You know,
Oh, gosh. How did you manage that,
I was
then?
on a mountain bike and I fell off. You know, crack.
Oh. All right, lovely. Oh, it looks absolutely fine. What was where was your concern?
Oozing out.
Oh, I see. There's no sign of infection. There's no redness, no inflammation or anything going on. So I can clean it and put a fresh one on for you at the moment. That's absolutely fine. But it looks okay. So I'll clean and redress that for you. Are you all right stood there?
Yeah, fine, thank you.
Okay. You must have come down with a heavy thud to have
had a crack as well, you know.
fractured your neck and femur. Goodness me.
Thank you.
Right, lovely. That's absolutely fine. Yeah, perfect. Have you got any more dressings?
I have,
yes. Yeah, okay. Right, that's it.
How are you?
Well, apart from falling over all over the place, I'm fine.
Well, really, are you? Yeah. How many different sites have you fallen over in?
Quite a few.
Really?
Yes, quite a few.
Did you injure yourself at all?
Yeah.
What's making you fall?
Yeah.
Really?
Yeah.
Dizziness, you mean? Or?
Well, no, I've had this, I had a really bad cold. I used to get infections every month when I was seeing Dr. Sharma. And in the end, she sent me to the hospital, they hoovered it out.
Yeah.
But what I'm bothered about is, I'm a bit unbalanced anyway with my fashionable statement here.
Yes, indeed. Yeah.
Socks and sandals don't go.
It's kind of you marking out your individuality.
Absolutely. So, but, you know, that's why I'm a bit wobbly anyway, even with my crutch, so...
Were you falling?
Yeah. Yeah, I mean, look, I've got a lovely... I mean, I've whacked my knee. Look that.
I see that. I thought Linda had just landed one on you.
Well, probably. She did with a black eye, but
Oh,
look.
my, look at this, yeah.
So it's, that's autumn and falling.
So how often are you falling? A few times a week?
Yes. Especially if I get up to go for a wee.
Is this ear okay?
Yeah, it's starting to sort of... I think it's feeling sorry for itself.
And do they get itchy, these ears?
Yeah.
Do you use olive oil in them?
I have done, yeah. To start with, I'd used olive oil, but...
Yeah, I see what this is like. There's not enough to hoover out, you'll be glad to hear.
Oh, I'm so glad.
But you should certainly be using ear drops. Open wide. Yeah, you're rather dry. Do you drink lots of fluid or not?
Not as much as I ought to.
Yeah, that's right, yeah. Your throat's very dry. This is an external otitis, so the canal, you're probably, for some reason, prone to it. I prefer you to use ear drops, yeah, and you use 2 or 3 drops in the right ear twice a day.
Oh, the other thing, I saw you were taking more patients back on a list.
Yes, I am, yeah. Yes, you can just write, you have to write to...
I have to write, do I?
Yeah, you do, yeah. And I'm very happy to have you back, but the request needs to come from you. Yes, yeah, good.
Thank you.
You've got to get up, slowly and carefully.
Oh, right.
I was going to say gracefully, but...
Graceful? Oh, well, you think I can't be graceful?
You can.
See, I dressed up for you today.
2,000... Yes, thank you very much. I do appreciate this. I'm getting better at recognising it than I was.
Yes, absolutely.
Yeah. It's very bad of me not to recognise that.
It is very bad.
It's a fiddle, Doctor.
Good on you, mate. See you, Clark.
Cheers.
It's a heavy door, isn't it?
Take care. Oh, she stopped crying now. All right then, bye.
Bye.